We are pharmacists from Babalola Multisystem Hospital. We are saying, Happy World Pharmacist Day! The role of pharmacists is strengthening the healthcare system. And as men of honor, we join hands. As men of honor, we join hands. Men of honor, we join hands. The theme for this World Pharmacist Day is the role of pharmacists in strengthening healthcare system. So, as pharmacists, we are proud to be a pharmacist. I'm proud to be a pharmacist. Can we say together? I'm proud to be a pharmacist. Presenting to us is our seasoned pharmacist from Amos. Can you introduce yourself and take over?
Good morning, everyone. My name is Pharmacist Ado-Ekiti. I will be presenting on the topic, the role of pharmacists in health system strengthening, a case of Nigeria. There is no other time to talk about the role of pharmacists. It's during and after the pandemics. By way of introduction, health system comprise of all people, including pharmacists, institutions, resources, activities, whose main purpose is to promote and restore and maintain the health system. Health system strengthening consists of responses and activities that are designed to sustainably improve a country's health system. Health system comprises of various components and can be put under significant pressure, just like we have seen during the COVID-19 pandemic. We are all aware that Nigeria is currently short-staffed in terms of healthcare, and a country that has been put under such pressure cannot withstand pandemic response. The role of pharmacists has undergone significant shift from product-oriented function to patient-oriented professional services. This shift is generally referred to as pharmaceutical care, which entails the interprofessional collaboration geared towards an effective therapeutic outcome. The role of pharmacists encompasses administrative tasks, providing highest level of care in society, and provision of medicines, especially during disease outbreaks. So, according to WHO in 2007, a framework was designed. It's called the block, the health system block. On the right hand are the resources that need to be strengthened in order to achieve the results on the other hand. So the main building block of WHO healthcare system is leadership and governance, healthcare financing, health workforce, which includes pharmacists of course, and medicinal products and technologies, information and research, and service delivery. So all these blocks need to be strengthened in order to achieve specific outcomes. So those outcomes include improved health, responsiveness, that's pandemic responsiveness, how the health system respond to pandemics. Then we have financial risk protection, and finally, improved efficiency. So pharmacists form an integral aspect of this block. They play a very critical role in making sure that the country achieves those specific goals, especially during pandemics. So what is healthcare delivery system? Healthcare delivery system in Nigeria is pluralistic. That is, it is comprised of the orthodox and traditional healthcare delivery system. The orthodox system stems from the Western science and constitutes hospitals, clinics, and primary health centers. Nigeria has three-tiered health system structure, including the primary, the secondary, and the tertiary. These systems perform distinct roles. So the primary health care system is responsible for, they are the primary point of contact with the community. They provide services such as immunization, disease prevention strategies, treatment of common illness and accidents. The secondary care system provides a specialized form of health delivery, while the tertiary provides another level of specialized healthcare delivery. So pharmacists and health system strengthening. Pharmacists are among the most accessible healthcare providers with an expanded responsibility in individual and community health. This role was actually brought to light during the COVID-19 pandemic. You know, during the COVID-19 pandemic, the healthcare system in Nigeria was significantly overstretched. In fact, as a matter of fact, the health workforce density in Nigeria is currently 1.55 to 1,000 population, which is below the WHO standard of 4.55 per 1,000 population. So you can imagine what happened during the pandemic. The health workforce was overstretched, and you can see how pharmacists came out and they made significant contribution in terms of pandemic response. I'll be discussing further on this. This function underscores the indispensable role of pharmacists in health system strengthening during pandemic. The role of pharmacists in health system strengthening cut across various planes of pharmacy practice, such as hospital, community, industry, academia, and regulatory affairs. So what is the role of clinical pharmacy in pandemic response? Pharmacists in hospital practice have contributed to improve patient outcome through adequate drug supply, rational prescribing, and prevention of medication-related harm. You could see during COVID-19 pandemic where healthcare facilities were almost inaccessible to patients. Pharmacists made sure that there was adequate supply of medicines, and also they contributed to preventing medication-related harm, because it was during that time self-medication was significantly pronounced. So pharmacists they played an integral role in ensuring that medication-related harm were prevented. So you could see people taking chloroquine, adulting chloroquine. You could imagine the side effect of adulting chloroquine. Arrhythmia, toxic disappointments, and can even result into death. Most people take it without medical supervision, and pharmacists were at the forefront of this to make sure that there is no medication-related harm. Clinical pharmacists, through interdisciplinary teamwork, are active members of the clinical trial teams. There were various drugs came up during COVID-19 that were postulated to be effective against COVID-19. Pharmacists were at the forefront of clinical trials to ensure that these drugs were channeled through the appropriate process to establish that they actually have the reported therapeutic effect. They also play an important role in pharmacovigilance and antimicrobial stewardship. You see, people began to take, because of respiratory tract infection during COVID-19, we found some people taking antibiotics unnecessarily without supervision. So pharmacists were at the forefront of this, checkmating unnecessary use of antimicrobial even in hospitals. Strengthening disease prevention strategies such as extemporaneous preparation of hand sanitizers, liquid hand wash, education and provision of personal protective equipment. And I'm proud to say that ABUAD-Pharmacy was at the forefront of this production of hand sanitizers and distribution of liquid hand wash during COVID-19. What is the role of community pharmacists? Community pharmacists play an important role in healthcare through direct contact with the community, through assisting with common health conditions. They educate and counsel the community on disease prevention strategies such as hand hygiene, social distancing, extemporaneous preparations, and busting misleading narratives about COVID-19. They also contribute to increase immunization coverage, telepharmacy services, disease surveillance, monitoring and reporting of adverse drug reaction. Industrial pharmacists perform clinical roles in pandemic research and development and improve access to medicine. They play an integral role in maintaining quality assurance and production management, regulatory compliance with assessment and management. Academic pharmacists were also at the forefront of research and development into drugs that are effective against COVID-19. Regulatory affairs pharmacists work in regulatory units to perform pharmaceutical companies and government bodies. They apply comprehensive knowledge of laws, regulations that bind manufacture supply of medicine and ensure legal compliance with pharmaceutical products. In conclusion, pharmacists are among the most accessible healthcare providers, especially during disease outbreaks. The uniqueness and versatility of pharmacists can be utilized to foster health system strengthening during pandemics. Thank you very much.
Pharmacist.
Good morning.
Well done.
Good morning. Hi.
Thank you. I'm fine. I'm actually surprised. The doctor did not give me cards or anything to document my checkup. And he asked me to come for drugs there.
Actually, here at ABUAD, we run paperless. Everything is digital. And that will help to reduce your waiting time, processing time. So everything your doctor is What's your name, sir?
My name is Mr. Abadi.
You visited the cardiologist today.
Yeah, exactly. Everything is there.
Everything is
Wonder shall never end. I think I love this. I love
You're
this.
welcome, sir.
Thank you.
Okay, so you have a prescription for amlodipine and also for lisinopril. Your blood pressure is quite
I
elevated.
don't know anything about
So
this.
these medications will help to reduce your blood pressure as well.
Thank you.
Pantekayo, please can you get me amlodipine 10 mg and lisinopril 10 mg as well?
Alright.
How are you feeling? Are you experiencing headaches?
No, sometimes I'm just headache here and the rise. My doctor said once I take my drugs accordingly, I will be fine.
Yes, these medications will help to reduce your blood pressure. Know that hypertension is not curable, but by using your medications appropriately, you're able to manage them. And as well, would advise that while you're on these medications, you do not stop them abruptly. If you notice that your blood pressure is reducing, you should speak with your doctor. If there will be any need to adjust the doses, he will inform you appropriately.
I will.
And also note that if you experience any side effects, any symptoms whatsoever, please always reach out to the pharmacist as well. And if you have any questions, please let me know.
I will definitely let you know. Thank you. I think I love this. You are even accessible.
Yes, we're here 24/7. If you have any questions as regards your drugs or your medications or any supplement that you might be on, please reach out to your pharmacist for information.
Thank you.
So you have to take this medication 1 tablet daily. You can take it after food.
After food?
Yes.
Thank you.
And as well, you take this as well 1 tablet daily. You can take it after food as well.
Thank you.
Yes.
Wow, I think I love this. I had some experiences that you are actually changing my orientation about. You said I can call you when I have any challenges.
Yes, you can reach out to the pharmacy if you have any question.
Thank you. I think I love this. And I will tell people about this very particular service you've rendered. I appreciate you.
You're welcome.
Thank you so much.
Enjoy your